A lot of people are nervous or anxious before they go to see the doctor, or they leave the visit and they didn't get out of the visit what they really hoped to. Today we're going to talk about how to get the most of your doctor visit. My guest is going to be my partner, Dr. Andrea Peterson, so stay tuned. Hi, I'm Dr. Eric Baser. We have a really interesting topic today. My guest is also my partner at this show, Dr. Andrea Peterson. We're going to do the show ourselves. It's going to be a little bit different. We're going to talk about how to get the most of your doctor visit. Dr. Andrea Peterson is a colleague of mine for many years. She's a hospitalist. She also works on clinical documentation. She's an internist. I myself am an internist and a hematologist. So we're going to talk a little bit about what you should do at home to get the most out of your doctor visit. Andrea, welcome to the show.
Thank you so much. It's great to be here and on this side of
You're sitting on the other side of the set today.
That's right. And you know, Eric, this is a topic that both you and I feel so strongly about because we really, I think our whole purpose in doing this show has been to help our community feel educated and knowledgeable. And part of that is really knowing what it takes to do to prepare for your doctor visit.
And I think more than ever people need to prepare because doctors are very much constrained in the amount of time they can spend with each patient. The doctors, in order to just keep their offices open, often have to see patients every 15 or 20 minutes.
And I think also the days of the doctor doing everything and the patient being relatively passive, those days are gone. And good riddance to them. We now really want patients and families to be active participants in care.
And with the availability of information through the internet, there is so much information they can bring, good and,
That's exactly
and confusing.
Right. That's
So
exactly
let's begin at the beginning. You're the average patient, you're going in, you're having some problem with headaches or shortness of breath or whatever. What are the things you need to do and to prepare for the doctor visit?
Well, I think, that's a great question. I think part of it depends on what type of visit is it. So it might be different if it's your usual routine physical as opposed to a visit you've scheduled because you have a particular problem. But for any visit, I think, really think about the amount of time you'll have with the doctor, what's really most important to you to be addressed, knowing that if you have a lot of things you'd like to be addressed, it's possible you can't get to them all in one visit.
Let's even start there, because I think that's such an important point. People may have a list of 15 or 20 problems that they perceive that they're having, and they want to try to get them all in when they're visiting the doctor. Realistically, the doctor's just not going to have enough time to deal with all of those. So how should the patient treat that? What do you do about having all those symptoms or all those things you want to address?
I think before you go in, take a few minutes to think about what's bothering you the most, what's concerning or worrying you the most, maybe what's concerning or worrying your spouse or your significant other or your loved ones the most, and feel free to make a list, write things down, and when you go into the doctor, give them an idea. Here are all the things that have been worrying me. Here are what I think might be the most important. It might be that the doctor looks at your list and says, actually, I think this chest pain that you listed as number 10 is the most important thing we need to talk about today. But at least it gives them a sense of what's going on with you.
One of the very good internists in town has been on our show, and he's talked about exactly this problem. And he would say to patients, well, I can deal with 3 problems today or 2, and I'll just bring you back.
Absolutely.
So I think people should have the expectation there's a finite amount of time. As you said, list what's most important to you. And the other thing I'd say is be honest. I think sometimes and be specific. A lot of folks think, well, I'm tired. Well, that's a very broad symptom, and we need more clues
Absolutely.
than that. So I think people need to think about, are you tired all day? Do you just get tired when you get anxious? Is it bother you most of the? Are you sleeping well? When did it start? Maybe we could go through what are the questions we always ask patients about symptoms.
That's a great point. So if you're saying if you're coming to me and saying I'm tired, I'm going to want to know exactly those things. When did that start? Have you always been tired, or did it start with a a certain precipitant? Did it start because you had an injury or because you had an illness? Or and what goes along with the feeling tired? What do you mean by feeling tired? Do you mean you feel sleepy and you have to take naps? Or do you mean you feel weak?
Or depressed.
Or depressed. How often does that happen? Are there particular times of the day when your symptom
So
comes?
we're really asking people to think about their symptoms
Absolutely.
in detail. Pain is a common one. We're all taught to say, well, what kind of pain is it? And you may think, well, what kind of pain is pain? But there really are different kinds of pain.
Absolutely. There's sharp pain, there's burning pain, there's dull, aching sensation that sometimes people don't even call pain. They may say it's a pressure.
So I think, think about the symptom, think about when it started, what makes it worse, what makes it better, and be ready to answer those questions. Because again, the doc is going to be, that helps us make the diagnosis.
Absolutely. But on the same token, I don't want our viewers to feel like they have to come with a ready-made diagnosis and they don't have to pre-think all of the questions.
And maybe we ought to say something about that, because it is really easy to put your symptoms into the computer and come up with a list of diagnoses.
Right.
And I don't mind that. I don't find that that it doesn't threaten me as a doctor, but sometimes it can be very scary to the patient and very worrisome.
It can. On the other hand, sometimes somebody might minimize something that the doctor might hear as something a little more important. So know that even though you have done a great job and have thought about your symptoms, the doctor is still probably going to want to ask you questions, and that's based on his or her medical knowledge and experience about what he or she is hearing from you. So for instance, we both have taken care of lots of patients who've said, well, I think I'm having heartburn. And sometimes it is heartburn, but if the doctor's asking you questions like, does it ever bother you when you're climbing stairs? Do you ever get short of breath with this feeling? They may be wanting to make sure that they're thinking about, could that heartburn really be something to do with your heart?
Right, because heartburn is really had nothing to do with your heart.
That's right. Heartburn is more acid reflux, and so that the doctor is going to use questions to tease out what's going on. But you may have looked something up on the internet and said, oh my goodness, I'm sure that I have this catastrophic condition. The doctor may be able to tease that out with questions to say,
and
no.
I think if you're afraid that you have a rare condition or a strange condition, if you think you have Tsutsugamushi fever, it's all right to say, doctor, do I have this?
Absolutely.
Because I think that we could reassure you, or not.
Right.
But
doctors want to know what you're worried about.
That's
that
right.
really helps. So it's perplexing sometimes for a doctor to not know why someone is so worried about a particular symptom that they're having. If they know the basis for that worry, well, my family member had this unusual condition, or somebody I loved had this and then died unexpectedly, that really informs the doctor about why you're worried and can help them help you.
So I think the messages to start with are, again, be aware of what you want to ask the physician, what you want the physician to address, understanding that there'll be a limited amount of time and a limited set of symptoms that they can have. Write them down.
Absolutely.
Think about them before you go in, so you can be as specific as possible and think about the timing, etc. Understand other things that may go on around them, and also know what you're worried. Don't be afraid to tell the doctor what you're worried about.
Absolutely, absolutely. Maybe we should talk about some other things to write down when you're going in to see the doctor, most notably your medications.
That's what's going to be my next topic too. Yeah, it is essential for us to know what medicines you were prescribed and how you're taking them.
Absolutely.
You may have been prescribed your blood pressure pill, but I can't tell you how many times people come in and say, well, I really haven't taken that for the last. That's really important to us, because if your blood pressure is high and you're not taking the medicines, we don't need to prescribe a new blood pressure medicine. We can go back to what was prescribed before.
Or if you're not taking it for a certain reason, tell the doctor that, so maybe they will prescribe another medication that may not have a side effect that you're experiencing. So they really need to know. And
we can even say a few words about that, because I think a lot of people think that just because something occurred at the same time that they took a medicine, that it's always a side effect of the medicine.
That's absolutely
right.
There's
a fallacy, and I've forgotten the Latin term for that, but you may remember it, but because something occurred coincidentally in time with something, it doesn't mean it was caused by it.
That's exactly right. And so, again, you may have experienced a symptom a lot of people feel that they get achy muscles when they take a certain class of drug called statins, which a lot of our viewers have heard about. They're excellent medications for cholesterol management and for helping
They're life-saving medicines.
Heart problems, coronary artery disease, and strokes. And so, but a lot of people feel that they get muscle aches. Well, sometimes a change in the medication or really thinking about it or can really help you stay on a statin if it's appropriate, right, and minimize those muscle aches. And so sometimes you may realize, well, actually, I started the statin and I walked extra, so maybe it was the walking extra that caused the muscle aches, not really the statin.
And the other thing is the placebo value of almost anything you try. So, people may say, well, I took this and it was great for my that. Placebo is very real.
Absolutely.
And the way we know, say, medicines work is we actually compare the medicine to a placebo. And only if it's better than the placebo can we say that it really adds something. But placebos really work. We don't use them. I think ethically, we don't use placebos to treat people, although doctors used to, with the old vitamin B12 shots.
And there's an ever-occurring conversation about that kind of in medical ethics and what that's all about. But right, I think generally we don't.
So we want lists of what you're taking and how you're taking it.
And before we leave that, I want to mention we want lists of anything you're taking over the counter as well, not just prescription medications. Anything you're taking.
And that includes herbs.
Absolutely.
And supplements.
Teas. Things you might not think of as medications can have real effects in your body and can interact with other medications or other herbs and supplements.
It's a superb point. Also, I think it's really important to understand that over-the-counter medicines, just because they're over-the-counter, does not mean that they're without risk or without side effects.
Absolutely. It's really important. So things like aspirin, which is another lifesaver for many people, can increase the risk of bleeding. It can increase the risk of irritating your stomach. Things like certain pain relievers like ibuprofen can also increase the risk of bleeding and irritating the stomach. So it's really important for your doctor to know everything that you're putting in or on your body.
That's right. And I'll say put one little add in there. Acetaminophen, or the brand name Tylenol, it is included in so many drugs. It's in 600 combinations. It's really easy to take too much of that.
That's right.
And so you really have to look at the dosage. You shouldn't be taking more than 4,000 milligrams a day, and one extra strength tablet of Tylenol has 500 milligrams. So be really careful of that, because if you're taking a cold medicine with Tylenol and you're taking Tylenol, you can reach that threshold pretty easily.
Absolutely.
And if you have liver disease, you go over it even easier.
Or if you drink alcohol regularly, you really should be taking even less acetaminophen on a daily basis.
Okay, we've got 1 minute less. What are some other things, Andrea, that we can get in the 1 minute?
I think, as you mentioned before, be ready to engage with your physician. Be honest with your physician. Your physician is not there to judge you. Your physician is really there to help you and help you in whatever health-related need you have.
And maybe one other thing. If you have trouble remembering what the doctor told you, which I think they've shown that people remember 20 or 30% of what a doctor said, it's okay to bring somebody with you.
Absolutely. I think it's recommended, especially if you're dealing with something complicated. If you're a patient with cancer, if you're a patient with heart disease or lung disease, if you have really important questions or big decisions to make about your treatment.
Just make sure you can talk in front of that person, that you can be honest.
Absolutely.
And we've run out of time.
It was a delight.
We could go on and on. So I want to thank Andrea so much for joining us on our show. And if you have questions at home or comments about this particular show or the way we've done it, please email us at healthtalk@wchn.org. Andrea and I will see you next week on Health Talk.